Hi, Dr. Shah. Welcome. I'm so excited to have you on the podcast.
Han, I'm so excited to be with you guys. Thanks so much for having us.
Yes. I've been doing solo episodes. So very rarely do I get to do interviews. So this is like a fun little change up. So I'm here for it.
Yeah, that's
So
awesome.
tell me a little bit more about you. We want to hear what got you into doing allergy stuff, like a little bit of your history.
Yeah, so I'm an ENT and allergist, and I essentially got an allergy because my wife loved cats, and I have like a terrible cat allergy. So what happened is we ended up at my in-laws house. I'm like, they're trying to essentially get them to like me. And I end up using a blanket that their cat used, and I end up having to go to the ER. And so it was just a very awkward episode because I just started swelling, couldn't breathe, had this big allergy reaction, and didn't really make the best impression on them. But we're married now, we have kids, so clearly it worked out in the end. But yeah. for the short period of time, it was kind of a tough thing. And so during my surgical residency, I realized I needed to do immunotherapy, or this method of sort of curing myself with cat allergies. Yeah. Didn't have the time during my training to go do shots. And so I learned about this treatment called sublingual immunotherapy and took it myself. It ended up working really well. Once I got out.
About to say, how's your cats now?
Yeah. So now to be honest, I don't have a cat allergy anymore, but I don't have a cat because I still have a little bit of PTSD from that whole going to the ER, getting all the medications kind of experience. And so, and it is very rare to meet someone who has a really bad cat allergy. I don't know that I've ever met another patient who had a bad cat allergy the way I did. I've met patients with cat allergies that make them sneeze and are annoying, but everyone's body is different.
Wow, that's crazy. So that's kind of cool, though. You kind of fell into it a little naturally, very organically.
Yes, definitely. Definitely organically. But yeah, and so sort of got into it. And then as an ENT, we focus a lot on the sinuses and airway and breathing. And so, of course, we treat allergies as well, because what we've learned is if we take care of your sinuses and we don't fix your allergies, you're still going to have sinus infections. And so what's the point of doing surgery if you're not going to actually fix everything?
Yeah. Yeah. Was this always something when you were in med school? Did you ideally want to be somewhere else in medicine? And then obviously you fell into it, but was this kind of a love a little bit?
Yeah. No? So it's always been an interest. My dad is a surgeon, and so I was always interested in medicine. I ended up choosing ear, nose, throat. My dad's a belly surgeon. I chose ENT because I was a music major, and I tried to be a musician for a little bit. Wasn't really good enough. I have a face for radio. That's why I'm hoping this is a audio podcast, not I'm kidding.
Yes.
And I just realized I wasn't good enough at music. I loved it. It was super fun, but it wasn't something I knew I could be really good at and that I could excel at. And so medicine was something that always made sense to me. I ended up going back to med school. Obviously, it just kind of was a lot easier. And so, but I chose ENT because that aspect of treating patients' hearing and working with professional singers and people who have voice issues and things like that. You guys can probably hear right now, I've got a little bit of a tickle and cough that I'm getting over. But ultimately, part of ENT is the nose. And so got really into how can we help people breathe better? How is breathing important for your sleep, for your overall health, and all these things? So allergies sort of came into that whole picture.
Wow. Okay. And so why do you think allergies? I feel I don't know, maybe it's just we know now, but I feel allergies are ever growing and it's getting worse and worse and worse. And is there theories behind it, or what's the understanding of why this is even happening in the first place?
Yeah, so there's definitely, one, you're absolutely correct. Allergies are increasing. So the CDC's most recent estimate is something like 80 million people in the United States have allergies. That means that 1 in 4 people. So everybody knows somebody with bad allergies. And what we've seen is since 1980, the number of people in the United States with allergies has doubled. So it's just increasing over time, and we expect it'll increase. And so some of the theories around it, I'll go over them. So the most overarching theory is that plants and pollen and all these things, they respond to carbon dioxide, right? So humans breathe in oxygen, plants breathe in carbon dioxide. That's what stimulates their growth. And as the world is changing, there's more and more carbon dioxide being put out into the atmosphere, either through cars, through things we're doing, and then just through the natural environment. So that what's happening is allergy seasons are getting longer and they're getting worse. And carbon dioxide actually stimulates more plant and more weed growth. So people with weed or weed pollen allergies are getting worse and worse allergies every year.
Wow.
But the second theory is this idea of what we call the hygiene hypothesis. And this is definitely still a hypothesis. So I always like to explain to people, there's some variability in it, and there's some people who aren't sure about it. But the general idea is that our immune systems are no longer fighting off parasites and things, that they used to be. And so they're now turning on ourselves. And the belief here is this idea of like, there's more autoimmune diseases, there's more diabetes, there's more, things like that, thyroid disease. And so we believe that what's happening is your immune system is essentially bored, right? When we were cavemen, we were running around the plains, our immune system had so many things to fight off, right? Tapeworms, bacteria. And now we live in a world that's just a little bit more sterile. And there's just a side effect to that. And some of that side effect is that your immune system actually can sometimes start to think things like pollen or tree or grass are foreign invaders and treat them like that. And that has been shown to be true in a number of studies in the allergy world, where basically when they look at twins, those who grew up in more rural environments who have more exposure have less allergies than those who grew up in the cities. People who have dogs and cats in their house tend to actually have less allergies because the thought is either the cat is bringing in some of the pollen and the dust, or it's just that there's bacteria and things like that you're being exposed to. And so when your immune system is young, if you're exposed to a lot, you learn that, not everything is something to get worked up about. But we live in a very clean society, so many people don't. And then what happens is, you can essentially see them getting allergies.
Yeah. I mean, definitely the same conversation goes for the gut microbiome, especially in the environment. Very similar studies are same thing, city versus rural, and exposure and all that. Do you have, just on top of mind, probably should have sent you some questions ahead of time, but anything on top of mind that you have to comment on, like gut microbiome and allergies?
Yeah, so all these are definitely related. And especially from the food allergy perspective, we think that one of the things that we're seeing is as we increase the usage of antibiotics regularly, it's affecting the gut microbiome. So, and then the other thing that's really interesting is there's an increase in C-sections. So when patients are born naturally or through the mom's birth canal, they're exposed to the mom's gut microbiome, or essentially the mom's natural, flora. And so unfortunately, for a number of reasons, which I'm not an OB/GYN, I don't want to get into, but there seems to be an increase in C-sections. And so you're seeing less and less of that exposure for children to the natural flora of the mom. And then one of the other things that's compounding this is another way that babies are exposed to the mom's natural flora is through breastfeeding. Yeah. And for other, just a number of reasons, a lot of times patients aren't able to breastfeed as much. And so again, you're getting that less exposure to your mom's natural bacteria. It's going to lead to your gut microbiome having just an abnormality. Yeah. And that can lead to food allergies, can lead to environmental allergies. And of course, it can lead to things that we're concerned about, like obesity and weight and endocrine dysfunction. Yeah.
It's pretty crazy. Probably my favorite thing, though, obviously, I mean, it's what we do, but just all the research that's coming out on it is really incredible, and just linking it to how it affects hormones and everything. And I'm like, the gut probably plays a role in that. Absolutely, yeah. Whether we don't know or we do know. So tell us more about Wyndly, just the company in and of itself. When did y'all start? What makes you so different from, anyone just going to a local allergist and getting immunotherapy? And then also, of course, sharing like shots versus drops, like what's the difference?
Yeah. So I'd love to tell you. So our startup that we've built is called Wyndly. It's an online allergy practice. And essentially what we do is once we identify what your allergies are using a home allergy test kit, our physicians who are licensed in your state will prescribe you a medication that essentially targets what you're allergic to. And over time, it desensitizes you. I kind of like to think about it as this way of essentially natural exposure therapy, right? So if we think that hygiene hypothesis is causing allergies, if we think that this lack of exposure to nature is part of why patients' immune systems are just overreacting, what if we could go back and give you a little bit of exposure to nature? What if in a small natural way, we could give you that pollen on a day-to-day basis and almost use it as medicine instead of using things like antihistamines and nasal steroids that, have some side effects? We wanted to find a way to naturally expose you. And so there's this technique called immunotherapy, and it's been done actually since like the 1900s. Farmers used to do it using hay to expose the farmers to hay so they wouldn't get hay fever. And so what we do at Wyndly is we send you medication, you take it by mouth, over time your body gets desensitized and you don't have to take medications. Now, all of this started out of our physical office here in Denver. We were doing this in our local office, but during the pandemic, patients were just they were a little bit anxious about coming into the office. People who were doing allergy shots, they didn't want to come in and get weekly shots. And so we switched everyone to what's called sublingual immunotherapy. And it's where you take the exact same medication as allergy shots, but instead you prescribe them so that you can take them orally. So instead of them being injected into your arm, you take them under the tongue. And by dosing it appropriately, they'll absorb into your bloodstream and you'll start to get desensitized over time. And so when used appropriately, you'll get the exact same benefits of allergy shots, but you don't have to go into an office every week to get a shot. And it's also found to be a lot safer, right? The risk of having a bad reaction is just a lot less. And the way I like to explain it to my patients is, if you have a pollen allergy, your body is used to breathing it in into your nose and your mouth. And so, you might sneeze and you might have those kind of reactions, but you're not going to have a big, crazy life-threatening reaction. If I were to take that pollen and inject it directly into your skin, it's just a different method of exposure. So your body isn't used to it. And so your risk of having a big reaction that's life-threatening is just a lot higher.
Okay. Yeah. Cause I mean, that's why cause I did book a consult with them and I talked to you and, it was like, a fear that I'm sure other people have of like, what about anaphylactic or like, what are the, percentages like that happen. So it's nice to hear that it is like a safer option for the people that are scared.
Yeah, exactly. Yep.
That's funny. Do you feel like efficacy is pretty much the same with shots or maybe a little bit less?
So what we've seen in the clinical studies is that both, and no one's ever done a head-to-head study because it would be hard. It would be hard. You basically have to have some people who are getting fake shots and some people are getting fake drops, and everybody would have to be doing both shots and drops and not know which one. So doing that like randomized double-blinded controlled study is really hard. But what we've seen in comparison studies is essentially the outcomes are the same. The biggest difference is compliance, right? So for some patients, going in weekly and getting a shot is really hard. It's hard with their life. They don't have time to sit there. They have kids, they have busy jobs. And so those types of patients, sometimes the drops are better. On the flip side, with sublingual immunotherapy, they did a really good study in the Netherlands where they sort of found that like, if patients were having to go in and get the drops from a pharmacy that was really far from them, or if they didn't have as much interaction with their doctor, they would sort of forget to take their medication. And of course, if you don't take the medication, you don't get the improvement. So one of the things we focus a lot on Wyndly is, look, we send it directly to your door. It shows up in your doorstep. So there's no excuse that you have to go to get it at a pharmacy. And we spend a lot of time with our patients checking in and making sure we're coaching them through this because we know if we can get them to take the medication, they're going to get great outcomes. And so we've been super thankful that our patients have done really well. And we're really excited about the outcomes we're getting.
Yeah. And you guys, it's kind of subscription, right? So I know it's like quarterly or payments or quarterly or yearly.
Yeah.
And obviously if you're choosing yearly, it's cheaper, but I mean, it's subscription. So it's not like you're even running out of days and waiting, right?
Yeah. So what we do is, we wanted to find a way to make this more accessible. Obviously, this is a treatment that was life-changing for me. Yeah. And so we found a way to work with, a number of physicians across the country so that we were able to bring the prices down from the pharmacies. And we're able to give this to most patients at a cost that's probably going to be cheaper than even if they did it through insurance.
Yeah. And I can attest. I never actually went and got the drops because I think I was like too geeked out, but I definitely feel A-okay about it now. I just have to actually do it. But I didn't, and I did pay $500 for I want to say it was like a month supply, and it was sublingual therapy. But
for sublingual local. Oh, got it. Yeah. And that's
expensive.
The thing. So sublingual can be expensive. And that was one of the issues that we had even when we were doing it locally. In order to give patients a really high dose, which is necessarily to make sure that they get the outcomes and the benefits, you have to use a lot of extract. And so it can be really costly. And we were having that issue. But one of the things that's been really cool is by partnering with physicians around the country, now we're able to bring the prices down because we're essentially buying in bulk.
Awesome. Yeah. I mean, y'all's pricing is bar none like the best that I've seen for sure. And I know we talked about this on our call, I know it's environmental. Share with us about like food as well. Cause that's what I asked you. I'm like, what about food allergies? Like, why isn't this available for food yet?
So I think it's coming, and there's a lot of people doing some really interesting research around it. Since Wyndly does a lot of our care through telehealth, we don't feel comfortable having people do food allergy treatments, not in a physical office. We're building out a second office here in Denver, and our plan is obviously to expand and have physical offices everywhere. And in that regard, we would do food allergy in a local office. The reason I like to think about this is, other than my crazy story about cats, most people who have an environmental allergy, you take them outside, you put them next to an oak tree, they're going to sneeze, they're going to feel miserable, their eyes are going to swell up, but they're not going to die. But if you give somebody who's got a peanut allergy a peanut, it's like a really scary, life-threatening event. And so it's not something that we feel comfortable doing, via telehealth. But one thing that is really interesting is there is an FDA-approved treatment called Palforzia that desensitizes children to peanuts. And it's been really interesting to watch the data. And a lot of this is based off this idea of, I think it's called the LEAP study, and I may be incorrect in the name of the study. But one of the things that happened is a couple of years ago, in the United States, we were advising patients to not expose their children to peanuts. And it's not really our generation, it's the generation before us.
Yeah.
But in Israel, they were saying, no, we should give kids peanuts right away. And when they went back and looked at the data, unfortunately, by not exposing kids to peanuts, we were actually increasing the risk of them developing a peanut allergy. And then, of course, when you have a peanut allergy, you go out to eat at a restaurant, and you have a higher risk of an accident.
Yeah.
And so we've really changed the way we think about foods in the United States, and where we actually now advocate for early exposure for peanuts.
Wow.
So I think that this exposure therapy, just this idea that like your body needs to learn what is good and what isn't, is something that we're changing across both food and environmental allergies. I think we need a little bit more research before the oral allergy treatment gets bigger here in the United States.
And right now, what is it? Like in office, like same thing, like exposing the food, but just in office under supervision?
Yeah. So for the peanut allergies, it's an in-office treatment. And then there is some of it that's taken at home, but every time the dose changes, you have to go back in the office. And so, and then for food allergy testing, same thing. Again, the gold standard is a food challenge where we give you something and we see how you do. And that has to be done in an office because, on the off chance that you're somebody who does have a bad reaction, you want to be supervised by a physician.
Yeah. So kind of like what you said, why is food so intense? And like you said, you go to, outside next to an oak tree, you start sneezing. Like, why is food so much more intense than you did have an intense cat.
Yeah. Yes.
But
why? Yeah. I think so. There's a couple things that can be at play. All right. So one is that environmental allergy is just the dosages that you're being exposed to is generally lower, right? The wind blows, you get a little cat pollen or dog pollen or ragweed or oak, you're getting a small dosage. And so your risk of having that really severe reaction is much different than when you eat a peanut. Because of dosages. But I think the other thing has to do with just, as you said, like the gut microbiome and the way that our immune system works in our gut is different than our way that our immune system works in the respiratory allergy area. So in your nose, it's things like IgE and IgA, but in your once things absorb into your blood, it can be IgG. And so there's just a whole bunch of different ways.
It's like a nuke bomb.
Yeah, exactly. Yeah, it's just a different thing.
Yeah. And so tell us, for all of our Austinite people who really struggle with cedar, do you give us any of the 411 on cedar? Because I heard it's one of the most, like, even just looking at it under a microscope, it is literally such a harsh, like, I don't know, pollen. Is that true?
Yeah. And so especially in Austin and Texas, there's just so much cedar fever. And we know it at Wyndly because we literally start to see the consults. Like I was just telling somebody else today, we know that the season is hit because all of a sudden our consults start getting booked up and we start having Austin. Yeah. And so what I think it is because of just the climate there in Texas and the number of cedar trees. And then also the fact that you guys are sort of the Great Plains. And so wind is just a big issue. And so the cedar just coats everything and it gets into everyone's nose. The other thing is it's a really small particle. And so because it's such a tiny particle, it gets picked up by the wind and you can breathe it in really deeply and it can get really far into your lungs. And so obviously one of the things we treat really frequently is cedar allergies. And I think what's interesting is in Austin, I think a lot of people are familiar with the sublingual immunotherapy method, just because, there's so many allergies in Texas. And so a lot of patients have friends or family who've been through it. And what we're trying to do with Wyndly is just make it super easy and accessible. You can literally get it from the comfort of home. We just want to make it so convenient for you.
Yeah. People even react to cedar and they don't even have allergies, but I think it's just like the pollen is just so irritating in and of itself. Yeah. I definitely have never experienced it until experienced environmental allergies until I moved to Austin. And then, it's always a weird season of like, sometimes it looks like little like dust storms, like that's how intense it is, like in person. But I've just never experienced anything like it until I moved here. And I'm like, what is this? This is just the craziest thing. And I think Austin might be known as like the allergy capital of the US or something, which is kind of crazy to think about. Cause I'm like, we're in the middle, nowhere. Like,
Yeah. But it's definitely where I think we get the most of our patients, just because, and it's interesting because like when we started our practice, right, we were local Denver, and we assumed, we'll probably just get a bunch of patients locally from our friends and family and people that know us. But as soon as we started, putting things out on the internet, and talking about what we were doing, we just started getting flooded with patients from Texas. And I think it's because it's probably a lot harder to see an allergist locally in Texas than it is anywhere else. And so, us being able to make it super convenient was, I think, a big, selling point for a lot of our patients.
Yeah.
And then I just think that the allergies are so bad that everybody's looking for a solution.
Yeah. Yeah. No, it is very busy. If you don't have established care, it is quite a bit to get in, which I'm going to ask of like time too, the timeline of doing a sublingual immunotherapy. What does that look like? Like if you start doing it this month, are you feeling better, or do you do it like throughout the year and it's more towards the end of the year that you start to feel the effects?
Yeah. So it's definitely better for sublingual immunotherapy than shots, right? When we talk about shots, we tell patients you're going to notice the biggest benefit between 1 to 2 years. With sublingual immunotherapy, because you're taking it every day, that increased exposure. In general, when you look at clinical studies for both the tablets and the sublingual drops, you tend to see that patients start to do better between 3 to 6 months.
Wow.
And of course, like some patients will notice improvement at 4 to 6 weeks. And we have patients who we get them started and they're like, oh my gosh. And so I think it really varies depending on your body and your allergies. But I tell most patients 3 to 6 months is when I would expect to feel better. And then as we go on through therapy with each year, you get better. And most people are in therapy for about 3 years. And then once that's finished, we usually expect you to have long-term relief. And that's based on clinical studies that show patients have relief for almost 8 years afterwards.
Wow. Wow. I'm about to say, so do you take it forever?
No, so you take your drops or you take your tablets or whatever your therapy is, you do it for about 3 years and then you stop. And then most patients, even if we test them 8 years after they've stopped, they continue to show the benefits.
Wow. Is there any type of person that should not be doing like sublingual immunotherapy?
Yeah. So there's a couple of patients who are not good candidates. It's usually rare diseases. And so there's a rare disease called eosinophilic esophagitis, which you might talk to patients about. And so with that disease, which is, as you can tell, pretty rare. With eosinophilic esophagitis, we don't think it's a good job. It's a good fit for you to do sublingual because there's just this concern that if you're taking allergens by mouth
right there
and you have and like if you swallow some and your esophagus is already like inflamed with eosinophils, we don't want you to get inflammation in your throat that could make your other disease worse. The other type of patient who can be a little bit of a challenge is these patients with mast cell dysfunction. And that's not, again, it's like a pretty rare disease, but there's some patients who just have their mast cells are releasing histamine at a sort of random pattern. And so mostly it's just hard for us to know if it's allergies or if it's the mast cell dysfunction that's causing their symptoms. And we don't want to put someone on a treatment if we're not sure we're going to get them better. Right. Ultimately, our goal is to try to get patients, pick the right patients and get them better. We don't start treatment if you're pregnant, mostly just because, again, if you were to have any type of allergy reaction, we wouldn't want it to happen if you're newly pregnant. Now, if you have been on therapy and you get pregnant, then at that point, your body's probably used to your treatment. And so we will always continue it even while you're pregnant, but we don't start it with people. So there's some nuance to it. And that's part of why we spend a lot of time really meeting with the patients, doing a full interview, full exam, really talking to them and figuring out how can we make sure you're a good candidate for what we're offering.
Yeah, I was going to say, walk us through the process of what that looks like. So I know you mentioned doing the allergy test and then you book a session with one of the doctors and then I guess you meet and like, what does the rest of the process looks like?
Yeah, it's super easy. So if you think you have allergies and you're not sure, or if you know you have allergies and you want to get treated, you can literally go to our website. It's Wyndly, WYNDLY.com, and you can purchase your allergy test right there. We try to get it to you within a day or two. It shows up at your house. You can take your home allergy test kit, super easy. If you have an existing allergy test that you've already had, you can skip this step. But ultimately, we want to figure out what your allergies are. And we can do that through a home test or if you've been tested locally. Once you get that set up, you set up a consult with one of our doctors. It's always someone who's going to be licensed in your state. They're going to meet with you online. They're going to talk to you. They're going to make sure you're a good candidate, and they'll do a full exam and history. And then depending on if you're a good candidate, we send you your medications, and your medications should show up to your door within a couple of days to a week, and you start your therapy. We then work with you throughout the entire treatment program to make sure we're getting you better, and we adjust it or personalize it or change it depending on what needs to happen. And then at 3 years, if you're feeling better, we take you off therapy and we celebrate.
Woohoo! Awesome.
Yeah, it's pretty easy.
Well, is there anything else you want to share? I so appreciate you like sharing all about Wyndly, and I'm excited to try it and everything that you guys are doing. It's really incredible.
Yeah, no, we're just excited to meet other providers like you guys who are just trying to do things a little bit differently, right? I think the traditional
Yeah.
healthcare system is so influenced by insurance companies that as doctors, we sort of feel almost like hamstrung, and like the way that we can give care is very limited, right? We have like 5 minutes with each patient, we're rushing through.
Yeah.
And so for us, what's been really nice with Wyndly is this idea of like, if we could step outside and build a practice just based on how we wanted to be cared for ourselves, we have all the time in the world. Our patients, we can access, our patients can connect with us 24/7. We have texting, email, video. We're just always there. And for us as doctors, it just gives us a better ability to connect with our patients and try to get them better. And so it's just been a really fun time.
Yeah. Yeah. Oh my gosh. I agree with you. That's probably like my most common questions. Do you take insurance? I'm like, no, I do not. And I know from the outside point of view, they definitely don't know, but from the clinical point of view, we just know like how chaotic it is. And I'm like, it is so different seeing a dietitian who just takes insurance to someone that self-pay. It's a whole different experience, 100%. So I'm with you. Well, thank you so much for coming on. I'm definitely going to put all the links in our show notes. So everyone can go check it out. And thanks so much for spending some time with us.
Yeah, we appreciate it.